Somehow along the way I decided I was interested in shoulder surgery. I think the shoulder is a complicated part of the body, and I found it very interesting, both from the anatomy standpoint, the different clinical problems. There were clinical problems that spanned all ages, all types of activities, so there was a lot of potential variety, and I liked the idea of becoming an expert at something that other people didn't really know that much about and weren't necessarily good at. The idea of being a general orthopedic surgeon and taking care of everything, which was the way things were, is just untenable. It's almost impossible to do that because the breadth of knowledge and skills that you need to have is tremendous. And the way to get better at something is to do it a lot. I think it's a reflection of the kind of environment that we live in, and that specialization is perceived as better, that when you're specialized you have more experience at what you do, you've had more advanced training, and you probably learn more as you go along because you're seeing and encountering not only the same things, but because you're seeing a high volume of a certain subsection of the population, you start to see more of the unusual things too. I see a lot of shoulder arthritis. It's a relatively uncommon problem, but that leads me to do a lot of shoulder replacements in addition to the other things that I do. There are unusual neurologic conditions that affect the shoulder that if you don't see very many shoulders or you don't have a lot of experience, you're going to miss those. So I often see patients who've had an incorrect diagnosis by a less experienced practitioner. The other thing about specializing in a part of the body like the shoulder, the elbow, is that it also brings you a bigger variety of patients to interact with, which I think is stimulating. And at every age range there's a different spectrum of problems, and the treatments aren't going to be the same and the problems aren't the same, so but the knowledge that you gain in managing them can be brought from one group to another. I often see patients who have problems that have been told nothing can be done for that. And that's sad, that a patient could be out in our world today and be told there's nothing, by someone who's probably supposedly educated and trained, that nothing can be done for that. You just have to live with it. There's been a tremendous technological advance during the past 20 years in all of orthopedic surgery, but particularly shoulder surgery. We now can image parts of the shoulder that in the past you really couldn't image. During the time that I trained and started practice, arthroscopic shoulder surgery was developing and advancing, and basically we went from doing a lot of surgery open to doing almost everything arthroscopically, and that's, I think, been a tremendous advantage. Once the technical aspects have been developed, the surgery is physically easier to do it arthroscopically. It's less invasive, so I think it's improvement for the patient. And there are things that we do that people just didn't treat at all. Patients come to us because they've had an injury or because they have pain that's developed unrelated to a specific injury, and they'd like us to help them feel better. In many cases, patients can be treated with physical therapy, medications, injections, and not need any surgical treatment. And then a smaller percentage of patients who have shoulder or elbow problems do end up needing surgery to get better. One of the most important things that I get out of what I do is having a patient tell me how good they feel. But the feedback that you get as a physician from individual patients is really uplifting. These are patients who were really having difficulties, whether it was unable to sleep because of pain, I haven't been able to raise my arm above my shoulder for 10 years. I can play with my grandchildren. I can go out and play sports again. I couldn't do that. That kind of feedback is really great. The best patient referrals in my practice come from other patients. It's word of mouth. And to hear patients say, I have a shoulder problem, I started asking around, and everybody I asked said your name. They say, I just figured I better go to see you.